Not easy. To tell a friend or family member that you're concerned about their safety and their chances of falling. So here are some tips that may help. Be considerate with the language you use. For example, it is beneficial and supportive to say things like, "I'm worried about you and want to help," as opposed to it seeming like an attack. The next is, be mindful of how you describe the changes you have noticed that pose a risk for falling. Be clear that you want to talk with your loved one about their overall safety. You may even suggest accompanying the individual to a wellness checkup that includes a fall prevention assessment, which is a simple routine test like a blood pressure or diabetes screening. Be mindful of your tone and body language and be positive. Know the individual's preference and communication style. As you can see here from this chart in elements of personal communication, 55% of communication is your body language. 38% is your voice and your tone. 7% is your spoken word. So what that means is if your body language and your tone are not in sync to communicate with this person, they're not hearing nothing you say. And remember also, stay positive. Stay away from the negative language. Patience is a virtue. Recognize that this conversation may need to happen more than once. Try to continue the dialogue and be considerate. Conversations about safety and fall prevention may be viewed as a loss of independence for some older adults. Usually, the process can take anywhere from 6 months to 2 years if the person has no immediate needs. So just be patient, giving them the information and educating them on the process, and eventually when they're ready, they will come around. The next thing I would suggest is to pair a doctor's visit with an enjoyable activity, such as going out to lunch or something else the individual enjoys. That way it doesn't seem like all the focus is on them and they're doing something, getting out of the house and integrating and doing something fun as well.